effusion can be transudative or exudative. What are the causes of transudative pleural effusion? So it can be either when there is an increase in the hydrostatic pressure of the vascular component, and other causes can be when there is a decrease in the oncotic pressure. Generally, any cause which will decrease the albumin of the blood, that will decrease the oncotic pressure, and hence water will be pushed out of the vascular component, leading to pleural effusion. If we talk about hydrostatic pressure increase caused, it can be CHF, constrictive pericarditis, and valvular lesions. Oncotic pressure decrease can be seen in cirrhosis, liver cirrhosis, nephrotic syndrome, and protein losing enteropathy. Let's look at some of the important causes of exudative pleural effusion. So it can be a paranephronic, which means there is an effusion which is secondary to the pneumonia. It can be due to malignancy, tuberculosis, rheumatoid effusion, and lastly Meeks syndrome. So these are the important causes of exudative pleural effusion. Now here are some very important point. You should know how do you differentiate clinically or in question between the transudative and exudative pleural effusion. So one of the most important distinguishing feature is transudative will always be bilateral, whereas exudative can be mostly unilateral but sometimes bilateral. So this is first difference which you have to keep in mind. Another very important point which very frequently they will ask in examination is what is the most common cause of pleural effusion, or what is the most common cause of bilateral pleural effusion, and the correct answer will be CHF or cardiac failure. So bilateral pleural effusion most commonly seen in your cardiac failure. And the last thing, very important, how do you differentiate between exudative and transudative when you do a pleural effusion tapping? Then what you get in a transudative pleural effusion is a clear fluid which does not clot, whereas in exudative the fluid will not be clear and it may clot while you lift it to stand. So these are the important causes of pleural effusion.